Okay, in the interest of time, we have a full agenda today. We're going to get started, but while the rest of the people are joining, I'm just going to go over some introductions in the beginning here. I wanted to introduce myself. My name is Lisa Whitman, and I am the Senior Experience Producer with Holy Redeemer. And we just want to read a disclaimer for you before we begin the program today. Today's disclaimer is to let you know that the information presented today is not intended to diagnose, treat, or replace the advice and care of your healthcare team. We advise you to please contact your healthcare provider as it pertains to your individual situation. And as a reminder, the information presented here today is what currently is available to us and is subject to change. Before we get started, I just wanted to go over some instructions of what will be taking place today. As a reminder, this program is being recorded, but attendees will be muted for the duration of the program. So if you are on the attendee line, you will not be heard. You also will not be on video at all for the entire duration of the program. We will be holding a Q&A session at the end of the program, and we will be utilizing your pre-submitted questions. So thank you for submitting those. But you also have the opportunity to submit live questions during the Q&A. The way you do that is by opening up the Q&A button at the bottom of your screen. That button looks like this right here on the screen. So all attendees, if you go ahead and click that, you'll be able to have that Q&A button open and submit any questions that you have for the panelists today, and we'll filter that into our Q&A at the end. As a reminder, please do not submit any questions containing your personal health information. Our agenda today is we're going to be doing some welcome and introductions, as well as reminders of the importance of the vaccine, and then sharing some stories and updates regarding the different areas from our panelists today. And then we'll close our program with a Q&A. At this time, I'm going to turn it over to Dr. Hank Unger, who is our Senior Vice President, Chief Medical Officer, and he is going to go over the welcome and introduce all of our panelists for you today. So Dr. Unger, I turn it over to you. Dr. Unger, I think you're on mute there.
Here you go. There's the first mistake. So I want to welcome everybody here and wish you a good afternoon as we talk about the COVID-19 vaccination program here at Redeemer. So as Lisa said, my name is Dr. Hank Unger. I'm the Chief Medical Officer at Redeemer. And over the next 45 minutes, I'll be moderating a panel of 6 physician specialists who will talk to you about various aspects of the vaccine program and hopefully answer all your questions. Dr. Carl Rosenbaum, who's the Senior Vice President and Chief Medical Director of Home Care and Population Health. Myself, Sharna Corin, who is an attending physician on the OBGYN staff here. Dr. Mike Luca, who runs Occupational Health and Travel Medicine. Dr. Keisha Martin is Chair of Emergency Medicine. And Dr. Tepper, who is a division lead for our Infectious Disease program, will be participating. Our goal is to answer all your questions that you might have concerning this program. So thank you. I'll start with a thank you for taking the time to listen, learn, and ask the questions that you have about the vaccine program. Everyone at Redeemer is an essential worker. And I don't just mean that as the CDC defines it. You are all essential to us. Nurses, technicians, physicians, environmental services, food services, business staff, support staff, and more. Every one of you is mission critical to the health system. And while the decision that you make around receiving the COVID-19 vaccine is of great importance to everybody here, to all of us at Redeemer, it is even more important to your own health and to the health of your family, your parents, your grandparents, siblings, and friends. Because the one thing we certainly know for a fact is that any one of us might be carrying the virus in our bodies, have no symptoms whatsoever, and infect those for whom we care the most. And while some of us may be less concerned about our own safety, we should recognize that the decision we make about getting the vaccine impacts more than just us. It impacts those that we come in contact with. We embarked on the vaccine program about 4 weeks ago. And during that time, we have given close to 3,000 vaccines. And at that same period in time across the country, there have been close to 100,000 deaths related to COVID. That is more than 30 times the number of people that died on 9/11. Yesterday in Pennsylvania alone, there were 5,400 new cases of COVID. That's in the state alone, the state of Pennsylvania. And we have close to 4,500 people admitted into the hospital due to COVID. Pennsylvania is approaching 20,000 deaths since COVID began. And it's important, I think, to realize that as traumatic as that number is, as concerning as that number is, that represents the number of deaths and not the number of people who will be impacted for long, long periods of time who've caught the COVID infection. Many of you who work in the hospital can attest to the fact that the majority of people that we treat go home. But you know that while they were here, they were very, very ill. They've been on ventilators, they're debilitated, they go home, it takes months to recover, and some may have chronic problems. So don't, as you make these decisions, just consider the mortality, which is high enough as the numbers I gave you, but consider how difficult it is for some to get through the illness itself. The good news, there is light at the end of the tunnel if we achieve high vaccine rates. Think about going back to the norm we once knew and loved. Vacations, restaurants, movies, the Eagles, maybe not the Eagles, but concerts, family gatherings, visits with families, no use of PPE. We can get there. That future vision is attainable, but only if enough people participate in the vaccine program. The internet is a great tool. It can inform, but it can also misinform. And there are many, many myths out there regarding the vaccine, some which may scare you away and prevent you from making an educated decision. So we've assembled as a group of clinicians here so that we can debunk some of those myths. We want to become the myth busters and answer the questions that you have. So I'm going to start by debunking the first myth before I turn it over to Dr. Rosenbaum. And the myth I'm going to debunk is that the vaccine itself can cause one to develop an infection with COVID-19. And there is no way, let me just say, no way that by getting the vaccine will you get COVID-19. It's not possible. There is no live virus in the vaccine, in the shot, in the injection. So it cannot infect you. The vaccine really is nothing more than a set of instructions for your own cells to build a single protein that sort of looks like part of the virus itself so that your body, your own body, can make antibodies against it. So it sort of pre-revs your own immune system so that if and when it sees the real COVID, it is primed to stop it in its tracks. In close to 95% of the patients studied in these vaccine trials, antibodies were produced. And that in and of itself is amazing. So if it doesn't stop the virus altogether, what we certainly believe is that it will prevent an infection from becoming severe. So that's my busted myth. You cannot get COVID-19 by getting the immunization. So let me turn this over now to Dr. Carl Rosenbaum, who is my compatriot in the outpatient world of population health. Carl?
Thank you, Hank. Thank you, everybody, for being here today. Myth number one, you cannot get COVID from this vaccine. There's no live virus. There's no other diseases that you can catch from this vaccine itself. The vaccine was developed to be safe and effective, and it was released under what's called an EUA, Emergency Use Authorization. The reason it's released as an emergency use is COVID is a deadly disease, and there's no alternative other than this vaccine to help us knock this out of our world. So that's why it was developed safely and released under this EUA. The vaccine has technology which is amazing, using a signal with messenger RNA. And the myth I want to bust is that even though you hear the words messenger RNA, it cannot affect your DNA. The vaccine does not alter your DNA. It won't turn you into a chicken. It won't do anything to make you better looking or worse looking. It basically is a one-time signal to produce that single part of the protein that Dr. Unger spoke of that revs up our immune system over time. It's a 2-shot series. We have the Moderna one currently, given over a 28-day period. First shot and then the second shot 28 days later. And after the 2 shots, approximately 6 weeks total, the studies show 95% antibody effectiveness. The reason the 2 shots are needed is the first shot is not conclusively protective. It helps a lot, but it doesn't do the full job. So it's a 2-shot series. And the shots help produce antibodies, but also other cells in our immune system are revved up to recognize this protein and attack it when the virus is exposed to the body. So definitely cannot cause any alteration in DNA, and we'll talk more about that. 2 shots, 6 weeks to be fully effective. It works safely. There's been 12 million doses of this given out between Moderna and Pfizer. The Pfizer and Moderna vaccines are essentially very similar. They're slightly different. One is 21 days, ours is 28. There's some storage differences, but otherwise they work exactly the same. So safe and effective is the key. The disease is not safe. The disease is deadly. The disease has long-term consequences, as you heard, and that's why vaccination is so critical. In the studies, 33,000 patients in the Pfizer study, there was only 1 patient who got sick significantly with COVID. Even those who broke through after that 5%, the disease was mild. So this is an extremely effective way of preventing serious disease and breaking this cycle. Other things I wanted to talk about is for those of you who've had COVID and recovered, thank God, we recommend that you get the vaccine, but we ask that you do it approximately 90 days after your recovery so that your body can reset itself and then reestablish further immunity based upon the vaccination. For those of you who may be receiving monoclonal antibodies, the same issue is 90 days or 3 months after the monoclonal antibodies and you recover is when we want you to have the vaccine. We want everyone in the health system to be able to receive this. We will be hopefully opening up further for some other people related to us in the health system. There's more to come on that. But right now our goal is to get every one of our family members in the employee to be vaccinated and protected. So a lot of information. I just want to make sure that everyone understands that these vaccines are being recorded in an EMR, Athena. That information goes to the state, and then the state has a record of your vaccination, and the government keeps track of everyone who's been vaccinated. So I'm going to turn this over to Dr. Corin, who is from our OBGYN department, to talk about specifics around females and pregnancy and all the things that people are worried about.
Thank you. Hi, I'm Sharna Corin with the Department of OBGYN, and I wanted to just specifically touch on and address women's health issues in regards to COVID and our vaccine options that are out right now. Briefly, I want to just discuss how COVID it really impacts women's health. What we do know is that pregnant women have a significantly higher chance of getting really sick with COVID if they get infected. Compared to non-pregnant women, pregnant women are 5 times as likely to end up in an ICU for care, which has happened multiple times at Holy Redeemer, unfortunately, where we've had to have our pregnant women admitted to our ICU and had to take care of them with the ICU teams hand in hand. In addition, sadly, pregnant women are much more likely to die from COVID. And the numbers are astounding from what we are used to, which is taking care of mostly healthy women. What we also know is that there's a lot of unanswered questions about how COVID will affect things such as fertility. There's some early evidence, believe it or not, that there may be some male fertility effect if you've had COVID. And as far as lactation goes, right now, if a woman has had COVID, we are recommending that she continue to breastfeed. So what does this mean for making the decision to go ahead and decide if you want to get vaccinated? And the decision is really to get vaccinated now, since Holy Redeemer is offering it, versus waiting for more information to come out. The studies that came out from the 2 authorized vaccines currently, the Moderna and the Pfizer mRNA vaccines, did not test pregnant women. They did have several women get pregnant during the testing, and they did sort of leave it to the guidance of the medical community as to what you want to do moving forward with the vaccine. And there's a few different really important groups that came out and said that we should consider this. So there's the fertility group that helps make guidelines for women that want to get pregnant. There's the OB group, and then there's the high risk obstetrical group. And the consensus among all three groups is that this should be something that's offered to pregnant women and should be discussed with their physicians. And it should not be an absolute no. You don't need to get a pregnancy test to move forward to get this as an option when you come out, and it's your option depending on what phase we're in on delivering the vaccine. So there's a few things that are important to discuss. In obstetrics, we don't give live vaccines to pregnant women because those can have problematic effects on the pregnancy, but these mRNA vaccines are not live. So this is not something that's going to infect you and your baby with COVID, and it's not something that's going to change the DNA for you or your baby, okay? As far as the timing goes, right now, the fertility specialists don't believe that this is something that you would have to hold off from if you're going through fertility issues or trying to get pregnant. They also say that if you get pregnant between doses, that you can still consider moving forward with the vaccine. In pregnancy right now, it's not being limited at any stage of pregnancy if it's something that a woman wants to move forward and get. And then after birth, if you are breastfeeding, this vaccine is not thought that it's going to go through your system into your baby. Your antibodies, which is what your body produces for protection, is what's going to pass forward. So I think that this is something that should be considered based on a few different things. Number one, what is our exposure risk? And right now, especially in the Holy Redeemer community, we're all getting exposed to patients with COVID, and it's in the community and the levels are pretty high. So given the community prevalence, I think that we're all overall at risk for contracting COVID just by living our lives in the community, but especially based on our work risks. So that's a significant risk factor. Number two, your medical conditions. Do you have any complicating issues, your age, other medical issues that could put you at higher risk? Because this can make you much more sick in pregnancy. So that needs to be considered strongly as well. I think that these are great things that can be discussed with your physician. And I think that with the numbers where they are now, getting COVID is probably much more of a significant concern for a woman, and especially a pregnant woman, than the vaccine is. And I think that we're going to sort of ultimately learn more about this vaccine and consider it like we use other vaccines, which is that we do recommend a lot of vaccines in pregnancy and women going through fertility and breastfeeding. And the assumption is right now, with what we know, that we're going to move forward in that overall when we get more information. Now, one of the myths that I got asked was, is there one vaccine over another that we're going to recommend for moving forward with? And is one over another better for your fertility? It's a really good question. Right now, we don't have that information. We have what they put forward with the mRNA vaccines. And we don't think that Pfizer or Moderna is one better than the other. As far as the ones that are coming out in the next few months, we don't have the full information, but none of them are live vaccines. So I think as we get more information, we may ultimately direct pregnant women and women that want to be pregnant in one direction over another. But right now, we have no reason to think that one is better than the other. And I think that the mRNA vaccines should at least be a discussion moving forward. So on that note, I'm going to introduce Dr. Keisha Martin, the chair of emergency medicine.
Hi, I'm Keisha Martin. I'm the chair of emergency medicine. I just wanted to talk to you about my experience in the emergency department and what we are seeing in the emergency department. We've been significantly affected, and there's a range of patients who are presenting to the emergency department. Of course, there are those who arrive in respiratory distress. They are intubated. They are admitted to the intensive care unit. And they receive all of the life-saving treatments that we have available to us. And some will make it and some won't, obviously. But then we have patients who come through the emergency department with relatively minimal symptoms, a little sore throat, a little fever, and they go home, and some do fine. But a fair number return a couple weeks later, and they're pretty sick, and they get admitted. So that's a pretty big range in terms of what we're seeing in the how sick patients are. It has impacted the emergency department, but I guarantee you that it has impacted the community as well, how our emergency department is operating under COVID. And the reason I say that is that we have 22 beds, and at times we have 18 of those full of COVID patients. And you can imagine it's difficult to see all of the patients in the waiting room when there are only 4 beds available. So people are waiting longer to be seen at times. There are patients in the community who you may even know who are afraid to come to the emergency department because they're afraid of getting sick. So they are staying at home with their heart attacks and their strokes. And they are either dying at home or coming to the hospital when it's much later in the course and they could have had a better outcome. I want to talk about one of the myths, which is that young people are not as affected by the disease. If you're young and you're relatively healthy, you're not as affected by COVID-19. I know of a patient who was 40 years old, no risk factors, not obese, and they presented to the emergency department in distress. They were intubated, put on life support, went to the intensive care unit. They were treated here and ultimately was flown out to Penn to not only have life support for their lungs to breathe for them, but life support for their heart to get blood to the rest of their body. And they are now on a transplant list for a lung transplant. And essentially that's what they need to live. And that's a 40-year-old with no medical problems. Sometimes we don't always think about how the asymptomatic carriers are affecting those around us who are at risk for severe disease. And I know of a patient who was there was a college student. Their college was shut down. The college student was COVID positive. He came home to his family, and everyone in the household got COVID. The mother, his sister, his 52-year-old father who had diabetes, and then passed away 2 weeks later. And I can't even imagine the guilt of that person. And I don't know that we're always thinking about how, if we were asymptomatic carriers, how that affects the people around us. And lastly, every time one of you, a Holy Redeemer health system worker, comes in contact with a patient who's positive, you're at risk and you're potentially putting your family at risk. And the last story I will tell is of a nurse in my emergency department who got COVID. She was pretty sick, was out for a couple of weeks at least, came back, felt better, and then became sick again and realized that her heart function had been affected by the disease. And so if you and I, our heart function is about 100%, we're healthy, our heart is working well, hers was less than 50%. And so her cardiologist really urged her to get the vaccine because there's no guarantee that she won't get COVID again. And so I will quote her words to me were, "This vaccine is going to save my life." And so she was excited to get the vaccine. She said, "This is going to save my life because I may not survive it the next time." So some recover perfectly well. Some don't recover, obviously. And then some recover with long-lasting effects, like the nurse in my emergency department. There obviously some people get some side effects from the vaccine itself. I personally had none. I had a little soreness of my arm, but I'm pretty sure that the side effects are not nearly as bad as what may happen if you get COVID and get the illness. So I'd like to turn this over to Dr. Rick Tepper, who leads our infectious disease department.
Thank you very much. And I'm Rick Tepper. I'm one of the infectious disease doctors at Holy Redeemer. And I just wanted to encourage all of you to get the vaccine. Another technical glitch there. There's a lot of reasons to get it, as Dr. Unger mentioned, but one of them is, you can think about maybe you're young and you're probably going to get through COVID if you get it, and we don't know about the vaccine, and why should I take the chance, and why should I take the risk? But this is not a disease that you really want to go through. The issue is that, yes, so maybe you're young and maybe you don't have really a very terrible case, and maybe you're not one of those people who are in the intensive care unit, but just in general, and having the fear that you have to go through while you're doing this is really, it's really astounding. And, seeing the people in the hospital who recover, and what they've had to go through with this every day and having to live with it. This is also a disease that has some very long-term effects. You can be sick for months after this. You can be tired, you can be short of breath, chest pain, cough, that sense of smell may not come back for a while. Impaired memory, you can have depression, PTSD, anxiety, trouble concentrating, and this can all go on for months. And it's really something that you don't really want to have to go through. People wonder, how safe is this vaccine? We've never, ever made a vaccine this quick. Usually it's years. And you have to understand the technology. And even though the technology is new for a vaccine that we've made, it's technology that they've been using and has been into the, in the lab for years now. And they have really just been waiting for, some chance to use it. And frankly, the results have been astounding. 95% efficacy is wonderful for a vaccine. And so it's really coming, at a time that we all need. There's been, as tens and tens of thousands of people. The vaccine wasn't approved until they've had at least 2 months of data for everybody. And the safety profile has been excellent. You can get some local reactions, pain, swelling, redness, chills, fatigue, people get fever, rashes, but this is really not unheard of with you see with other vaccines. I mean, I remember seeing somebody come in with a pneumococcal vaccine and their entire arm was swollen and red. And, it was not subtle at all. And so you're not looking at reactions that are actually any different than what we usually see with vaccines. People talk, well, my arm was red and maybe I got an infection from it. Again, not something that we unheard of. This is something, people of us who've been dealing with patients who've had vaccines, it's really nothing really out of the ordinary. I get a flu shot. I had my vaccine, I had swelling. I had more problems, getting a flu shot or my shingle shot this year. So I'm not really, concerned that much with the side effect profile of it. People talk about, you had COVID and you got more symptoms now when you got the vaccine, but really, in my experience, I haven't seen anybody complaining really of it. So, in terms of, you get side effects, the CDC recommends Tylenol and Motrin if you do get something after taking it, period. So and there's no data to say that Tylenol or Motrin or anything else is going to affect the vaccine and what the efficacy of it. And if you have underlying conditions, again, there's no data that says that taking the vaccine is a problem. So with the vaccine, they've been giving vaccines to cancer patients for years and without a problem. People with immunodeficiencies, CLL, bone marrow transplant patients. And in these people, the effects of COVID are much worse. Immunosuppressed patients have a much more likelihood of getting sick and in going and ending up in the ICU and having severe COVID. So taking the vaccine is a much better option than those people getting sick. Now, there may be in someone who's immunosuppressed, you may not get as a great reaction in terms of the immunity, but in doing this for years, I can tell you it's better than not getting vaccinated at all. One other concern was somebody said that they could make more likely to get HIV from this. The vaccine has nothing to do with HIV. There's no HIV in it. There's no part of HIV in it. This came from a story from years ago when they were trying to make a vaccine for HIV using an entirely different mechanism, not a messenger RNA. It was an adenovirus. Absolutely nothing to do with it. And I would not have any HIV concern about all this. I would, again, before I pass on, I'd like to encourage you all to get this vaccine. As Dr. Unger said, it's not just in protecting, our individual cells, but it's also protecting everybody around us. And the more of us get this vaccine, the better likelihood that we will, as a population, develop a large amount of immunity. And that once that happens, the number of people who are susceptible will go way down, and that this will let the entire infection peter out so that, again, we will be back to normal. What we all remember from normal from last year, not having to walk around with masks, being able to go out to eat for dinner, being able to get together with friends. And so I would really like to encourage everybody and anybody, once they are called that they can get the vaccine, to go ahead and do it. Now, I would like to go and pass off the baton here to Dr. Luca, who is our occupational health physician.
Hello, everybody, and it's a pleasure to be with you. They asked me to share a story, so I guess from the story side, I can't wait to get my vaccine, and the only reason I haven't gotten it yet is because I had COVID. And not only did I have it, but my wife had it, and my mother had it. So, and it affects everybody differently. For me, it was a bad cough, a lot of fatigue, and a loss of taste and smell, and some diarrhea that lasted for about 2 weeks. And my smell still isn't quite back. My wife, she still hasn't gotten her taste back, but she had very similar symptoms. And for my mother, who was older, 87, who got it in a nursing home, although she recovered from the illness, which I didn't think she was going to recover from, she was very, very weak from it and very short of breath from it. She has now developed some significantly worsening dementia. And this is now over a month, close to a month out from when she had the illness. And although she appeared to be on the mend, she deteriorated, just as some of the other stories you have heard. So I truthfully, I can't wait to get it. On my date coming up is the end of middle to end of February, and I'm looking forward to boosting my immunity. So I want to debunk a myth about getting the illness and or the vaccine, that you don't have to wear a mask anymore after that. And that is totally not true. You should always wear a mask, even after you get the vaccine. And there's really 5 reasons, why you should be wearing a mask after you get the vaccine. The first is that no vaccine is 100% effective, and we've heard about 95% effective, and this vaccine is an excellent vaccine, but it's still not 100%. So there's still a chance that you can catch the illness. The second thing is vaccines don't offer immediate protection. So I have had, I get a lot of calls here through occupational health of employees who got 1 dose of vaccine who, have ended up coming down with COVID. 1 dose of vaccine doesn't give you enough protection. So you have to continue to wear your mask, continue to follow social distancing, continue to wash your hands and stay away from your face, because it's nothing is 100%, but we know masks do work. the vaccine also may not necessarily prevent you from spreading the illness. I mean, there are vaccines that protect you against the illness and coming down with the symptoms. And then there are vaccines that protect you against infection. And it's unknown right now if this COVID vaccine will protect you against both illness and infection. We know it will protect you against illness, at least 95%. But against infection and your ability to spread it to somebody else, that's not known yet. So the safest way is to wear a mask and to follow still all the social distancing guidelines that you've been reading about and that you've been hearing through the health system. Masks protect people with compromised immunity. I mean, folks who get this vaccine, if you have a compromised immunity, you may not mount a big antibody response. So it's very important that you wear a mask and that the people around you wear masks, because for you, it may not give you that 95% protection. And the last reason why masks are important after you get the vaccine or have had the illness is, we know that this COVID vaccine is changing a little. There's some different strains. And we know now that this vaccine is probably going to be effective against these different strains. But viruses are tricky and they can keep switching and changing. And, there may be a time where this vaccine may need to be modified at some point, but nobody knows. So the best thing is to just keep wearing your mask. This is the best way in which you can avoid, getting yourself sick and other people around you sick. And that's it. And I'm going to turn it back to Dr. Unger because he has some additional information.
Thank you. So there are a number of questions that I want to ask the experts on the panel to address. Some have been provided to us by email before and some have come live. So Dr. Tepper, there have been a number of questions about side effects in terms of whether reactions somebody might have had the first time with a swollen arm means that they will get it the second time and in fact be worse. Somebody wanted to know if they had a reaction to an influenza vaccine before, are they more likely to have a reaction to this vaccine? And the last part of this question is it likely that we will need to get another vaccine a year or more down the line for COVID?
Well, in terms of the severity of the reaction the second time, yeah, you can get a more severe reaction the second time. But again, it's not like it's going to cause, necessarily anaphylaxis or something very severe. If you had a swollen arm, your arm may be more swollen the second time. I look at this as your body's immune system is therefore good. I had almost minimal reaction, and now I'm worried did my immune system not really give a good response. While I'm hearing about these people who had these very vigorous reactions to it, I'm kind of jealous. I don't think they have to worry. It's still usually things that are manageable, cold compresses, ibuprofen, acetaminophen, rest. And so, yeah, you can get a more severe reaction the second time. In terms of other vaccines, in terms of, influenza, et cetera, just because you had a severe reaction to influenza doesn't mean you're going to have a severe reaction to this. Entirely different vaccine. Only if you had an anaphylactic, immediate hypersensitivity reaction would you have to worry. And then at that point, it's just increased monitoring for longer rather than, not taking the vaccine. And what was your third question was? I forget already.
I knew you would ask. It was whether the reaction be worse. Will we need a different or an additional immunization for COVID in the future?
No. At this point, we don't really know that. We don't think so. But again, because the vaccine has only been tested for so many months, the immunity on the vaccine, if you look at the numbers, they're higher than the numbers that you would get for the actual disease. which is actually kind of astounding. You know, most of us would think that the immunity you get from the actual disease is much more long lasting. And given the titers that I've seen from the vaccine that are higher oftentimes than what you get from being sick in the first place, and I suspect that we're not going to need another shot after this. You know, the whole goal of giving you the vaccine, it's not just, you know, it is keeping you safe, but it's also, if there's enough people with the vaccine that have enough immunity, this virus will end up petering out because there won't be enough susceptible people in the population to keep the vaccine going. And that is our hope. And so, you know, we're not really going to know until next year for sure, but you can be absolutely 100% certain that there are people who will be continuing to watch this until then and longer too.
Thanks, Rick. Carl, a couple questions came in that I think you can address. One is that there has been discussion out there, especially I think in England, about moving the vaccine out so that there are enough for, if you will, mass vaccinations initially and delaying the second shot. So the question is, are we on track to actually receive the scheduled second dose, or what will happen if we have to, if we have unavailable stock and we have to delay getting it? So will we be, and are we planning for the second dose? And the other question that I would push out to you is how long after you recover from the virus can you get the vaccine? So how long do you have to wait after recovery, and will there be enough to give the second shot?
Thanks, Hank. So first question, as far as if you've recovered from COVID, we want you to wait 90 days and then get your vaccination. And as Dr. Tepper just mentioned, the idea is to boost the immune system so that you can be further protected with the vaccine over the course of the 2 shots. For those who simultaneously picked up COVID after they got their first shot, we're actually recommending go forward as long as they're out of quarantine and get their second shot at 28 days. So that should cover those 2 things. The studies that were done to show that the vaccine is safe and effective were done with 2 shots. And we plan to give both shots 28 days apart, Hank, because that's what's proven to be most efficacious in treating, in getting the immune system revved up to be fully effective in preventing further COVID. So we will hopefully continue to give that second shot. It's all dependent on the vaccination received by the government to us. And that may change as people may realize that after the new administration takes over tomorrow, their goal is to try to push out as much vaccine as possible. But we plan on having enough vaccine for everybody to get their second shot at this time.
Thank you. Just an announcement, we're going to go to 105 because there are a number of questions we want to get to. So we'll go a couple minutes longer. Next one I'm going to direct towards Mike Luca. Dr. Luca, the question is, the recognition that occupational health is not necessarily collecting data on vaccine reactions. If there is a non-life-threatening reaction, how should an individual report that, and to whom and how should they report that?
Well, probably the best way is when you when you sign up for your vaccine, you're given information about something that the CDC has called VSafe. It's an after vaccination health checker. And for those of you who don't know what it is, I just show you what it looks like. Just if you were to go to the website and see, it's right off the CDC website, and you'll get information about this particular app that you can put on your smartphone. And what it does, this app is it's a text messaging and a web survey tool that allows personalized health check-ins after you receive the COVID vaccine. So through this app, you can tell the CDC any side effects that you might have had from the vaccine. And just like Dr. Tepper said, many of these side effects are common. You know, the sore arm, the fever, the muscle aches, they're very common side effects. So these are things that you can record yourself, goes right to the CDC. And if there's any side effects that the CDC sees that are atypical, the CDC may call and they may call you and check on you to get more information about it. So that's probably the best way to keep track of it. If you call into occupational health, we record them, but the CDC wants to know, and this is the way in which they have put in place for anybody who gets the vaccine to record a vaccine reaction. Plus, the app is very good in fact that it can remind you when to get your second shot.
Mike, are you on an Apple phone? One of the questions that just came up is that they tried to get VSafe on their Apple phone. It was not available. Are you on Apple or Android?
I'm on Apple phone. I obviously didn't get the vaccine yet, so I didn't download it. Okay. But the bottom line is that once I get it, I'm going to go and download it. And I'm sure you could, but it is a smartphone-based tool. But I haven't actually put it on my phone yet.
Okay, thanks. Next question. I'll defer this to Rick Tepper. Is there a significance to the dose difference between the Pfizer, which is at 30 micrograms, and the Moderna at 100? And what does the difference represent?
Well, not being an expert in how they made the vaccine and why the storage is different and why the amount is different, there's more to the vaccines that when they're making them than you can than just the bit of messenger mRNA. And that may have something to do with, why the storage is different and why the amount is different. The bottom line is that they both came out as 95% essentially effective. Somebody says, well, why is one 3 weeks and why is one 4 weeks? And I would tell you, I don't know why or even if there's a rhyme or reason. A lot of times these companies will have people with experts in other vaccines and in the technology that they're using. They'll have animal models that they've looked at, and then they will do this and they'll run a study. And you can imagine what it's like to run one of these studies. Huge number of people, huge expense, a huge risk for a company to run one of these studies. And so they've put a lot of thought. They're doing the best they can, but this essentially is how, a lot of things get developed and not just vaccines. And so, so they go and they do it, and the proof is in the pudding. And that is why the FDA required everybody to go 2 months to see efficacy data. They weren't just interested in antibodies. They weren't just interested in the lab and what antibodies and how much you have, even though I was very impressed. They actually want to see efficacy. And so they had it so that the people who got the vaccines, they had to wait for those people to have a certain number of infections for the placebo versus the vaccine group. And only until they had enough infections could they analyze the data and actually tell you that it was 95% effective. So no, I know people, and I've heard, people talking, I want this vaccine or that vaccine. They are both effective. Both have similar side effect profiles. Obviously, it's easier to give the Moderna because you don't have the same cold storage requirements. But, if somebody offered me the Moderna or the Pfizer, I would take whichever one they're offering me.
Thank you. Before I turn this back over to Lisa to close, I want to thank everybody on the panel for participating. I think that the takeaway lessons, if I had to summarize from what I heard from everyone, is that the risk of getting a COVID infection far exceeds any risks associated with getting the vaccine. And that while you may not be at risk, or you think you're not at risk yourself because you're young and healthy, one, as Keisha Martin pointed out, a young person became very, very ill, but two, you're putting others at risk around you, and that becomes a compelling reason. And I would ask that all of you, as you sit and put all the facts together, consider all of these things, not only your health, but the health of those that you come in contact with, parents, grandparents, siblings, others with immune compromised disease that are good friends of yours. Keep that in mind. I also am walking away with an understanding that both of these vaccines, Moderna and the Pfizer are essentially the same. And as Rick points out, one may be a little more difficult to manage because of the way we have to do cold storage, but when they're delivered into your arm, it is the same. And we have not had really significant adverse reactions. We've had side effects, but as Dr. Tepper pointed out, he was distraught that he didn't have a big side effect, which makes him wonder whether he has a strong immune system. So having a swollen arm, having some fever, feeling tired may suggest that you are really responding to this vaccine. So I hope that all of you think seriously about, if you haven't already decided to get it, that you think seriously and hopefully think about the things that we brought forward, especially not just about your own health, but your families and those that you love, and protecting them. So Lisa, I'll turn it over to you.
Okay, great. Thank you all so much for the presentation today. I want to thank all of our panelists today for sharing their information and their knowledge with us and updating us on the vaccine. And I also want to thank all of the attendees for all of your wonderful questions and for submitting them live today. There will be a recording that we will be sending out in the upcoming days of this webinar. So please be on the lookout for that. I believe it's going to be going out through Redeemer Relations, so it will be an email. So please share that with your teams and your staff as that becomes available. I want to remind you to please mask up, wash up, stay 6 feet apart, and remember to sign up for your vaccine. Thank you so much and have a wonderful day and stay safe.